Good evening. I am LaEunice Brown, Family and Community Engagement Specialist. This webinar is brought to you by Chesapeake Public Schools Office of Family and Community Engagement, or FACE, Office of Exceptional Learning, and Kempsville Behavioral Health. Tonight, I have with me my FACE partner, Lisa Carey, Tawana Fortune, Office Chair of School Psychologist with the Department of Exceptional Learning, and Marie Renner, Director of Community Relations for Kempsville Behavioral Health. Before we begin, we want to do a commercial break to advertise some resources and events that are happening in the area. I know your children are probably receiving their quarterly grades soon, and you may be looking for tutoring for your child to help. Chesapeake Public Library is offering free safe tutoring services Monday through Thursday from 3 o'clock to 8 p.m. at the Cuffey Outreach and Innovation Center, formerly known as the Cuffey Center. For more information on the services the Cuffey Innovation Center and FACE offers, please support our Chesapeake Family Resource Drive through event on Wednesday, October 21st, 2020 from 4 p.m. to 6 p.m. FACE will also be offering another webinar on Thursday, October 29th at 6:30 titled Parenting in the Pandemic with Family Insight and Kempsville Behavioral Health. Please, right after this webinar, go right to the FACE website to register. Tonight, I'd like to acknowledge Disabilities Awareness Month. Virginia has recognized October as Disability History and Awareness Month. The purpose is to promote positive attitudes in schools, which will create a culture of mutual respect, understanding, and equal opportunities for all. This month, the Virginia Department of Education is encouraging conversations between young people, their families, special education advocacy, advisory committees, parent resource centers, local school division leaders, and throughout communities about the importance and value of inclusive practices and planning activities that will promote the goals to meet this initiative. Tonight, the Office of Family and Community Engagement has chosen to have a discussion about anxiety and depression, which has become prevalent as a result of today's global pandemic. For tonight's agenda, we will discuss anxiety and the meaning, types, symptoms, and triggers and impacts on youth, as well as how to support someone who may be suffering with anxiety. We're going to look at depression, the meaning and causes and symptoms of it, and how to support someone who may be suffering from depression. Then in the end, we're going to discuss how they may fit together, as well as share strategies that will assist you and your child if your child is experiencing anxiety and or depression, with treatment if it's necessary. I want to share with you that throughout the webinar, you are encouraged to ask questions. You can put them in the Q&A box, and sometime during the presentation, we will be answering those questions for you. Then at the end of this presentation, we will provide you with some resources that you can use if you feel that you have a child who may be suffering from anxiety and or depression. Right now, I want to introduce my guests. Hello, Tawana and Marie. It's great having both of you here to participate in this very important discussion. We're going to talk about anxiety and depression, but before we begin, Marie, I do want to ask you this question. I want you to clarify the difference between mental health and mental illness.
Well, first, I'd like to thank Chesapeake Family and Community Engagement Center for having us this evening. We will be discussing some heavy topics in the mental health realm, and I hope that you are able to have some takeaways from this presentation. So let's begin first by defining mental health. Mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also helps determine how we handle stress, how we relate to others, and make choices. It's important at every stage of life, from when we're young children throughout our adulthood. This applies to us as parents and caregivers, and being aware of how we handle situations and interact with our children. Our modeling reactions or lack thereof is incredibly important. Modeling appropriate cues for our kiddos is so important, because they'll use the cues in how either he or she communicates with others. So then let's look at, if we can, mental illness. Mental illness is defined as a condition that affects a person's thinking, feeling, behavior, or mood. These conditions deeply impact day-to-day living, and may also affect the ability to relate to others. This is important to understand, as there are a lot of children who suffer and are managing a mental illness, and in many cases, not even to their knowledge. So part of our job as parents and caregivers is to help them identify what is going on, provide them with some helpful resources so that they can be more successful.
Okay, well, Tawana, can we get into the discussion on anxiety? Can you tell us what is actually anxiety and how is it caused?
Yes, and I too want to thank you guys for from the Office of Family and Engagement Services just for incorporating Chesapeake Public Schools in this webinar. I'm glad to be here to offer some services to our parents. But before we get into what is anxiety, I just want to take a pulse check and let us all recognize all of the different types of what we call models that we're moving through. So right now we have what we call the medical model, and we're dealing with COVID-19 and all of the stressors that go with that. We have the sociological model, which means that we're dealing with some of the social injustice movements and moments that have occurred across the United States and actually the world. We also have our mental health model, what we're going to be talking about today, that talks about anxiety and depression and the increases of numbers. And all of that is culminating in the educational model, which is with our virtual education. So when you think about having 4 of these different types of model, I call it like a layered cake. When we layer each one of these models on top of each other, all of us, and I say all of us, are having some sort of reaction that is impacting our daily life because it is something that we have not experienced before. So before we start talking about it, I just want to validate for people that if you are having some feelings of anxiety or you have some moments that you're thinking differently than you used to prior COVID-19, most of the world is just trying to determine how we're going to move through that and if you're handling that in a mentally healthy way. So what we're going to start off with is anxiety. And anxiety is a disorder that involves extreme fear and worry. And when we say extreme, that means taking it to the level where perhaps you can't pull yourself back out of that level of fear or that worry. It includes lots of different types of anxiety. We have generalized anxiety disorder. We have panic disorder. We have panic attacks, which I think we have the panic disorder, and the panic attack falls up under the panic disorder. And we have some students who may be having panic attacks. That means the shortness of breath, sometimes the tingling of the feelings, not being able to catch their breath, sort of kind of feeling like the walls are closing in. We have social anxieties. We have selective mutism, which means that a child, if it's in the school setting, may not talk at all in the school setting and then may go home and chat. And the teacher always says, but they won't say a word in class. And the mom's like, they talk to me all day long. So that too is a part of the anxiety disorder. And of course, we have separation anxiety, which developmentally, you might think some kindergarten students may have symptomology of that. But once we move past the kindergarten, first grade, and if we're still starting to have some separation anxiety, that's when our red flags go up as school psychologists. And then we have specific phobias. So those are some of the types of anxieties that we have. I think we're going to move, if I could get the next slide, we'll move into
the different types.
Yes, the different types of anxiety. So, you know, we have obsessive compulsive disorder, and that's when we have perhaps people are counting the steps that they're walking, or perhaps we have what we call compulsive hoarding, where people hoard things. We have lots of TV shows that deal with that now. People that constantly wash their hands. Those are some of those obsessive compulsive disorder items. Post-traumatic stress, we think about that a lot with our military, but you know, a lot of kids perhaps who've gone through some type of trauma could too have some post-traumatic stress, especially if they've experienced the trauma, or perhaps if they've even seen trauma happen to a loved one. They can incorporate some of that post-traumatic stress within their own being. We have generalized anxiety disorders, which is just the ongoing anxiety means of handling stressors in your life. Social anxiety, when we talk about people being in large groups or just the thought of perhaps even leaving your home. And then panic disorders, again, when you have that fight or flight or fear of moving into a situation that has a trigger for you. And we're going to talk about some of those triggers. So when we talk about, I'm sorry.
Yeah, go on.
No, I
Could
was
you?
just saying, when we talk about anxiety disorders, there are a lot of anxiety disorders that fall under the general anxiety disorder mode.
Okay. Could you tell us what it feels like? Can you describe to us what it feels like to have
Wow. Yeah.
anxiety?
Yeah. So anxiety is one of those disorders that sometimes we know exactly that we have a trigger and something has actually happened right beforehand.
Mm-hmm.
And then sometimes anxiety moves in on us a little slow and it just sort of kind of happens along the way because we don't understand that the trigger has happened. But in our body, there's a sense of being irritable. Sometimes we can feel very restless. We can feel fearful or nauseous. But some of the other things that we could have too is palpitations of the heart. And that's, one of those things that really gets our attention when your heart starts to have palpitations. Or sometimes people break out into a cold sweat. They get sweaty hands. A lot of times I call it my high school nervous knee. When the knee bops up and down, bop, 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 bop. And when they come into my office, I say, oh, something's going on because that leg is shaking. So I know you got some anxiety going on. So there are a lot of biological and physiological ways of us to see that anxiety has landed within someone's being.
Okay. Well, could you tell us a little bit about how we could actually identify if our children are experiencing anxiety?
Right. So that's what we call triggers. So when we think about the triggers, we're thinking about what is it that has happened prior to. In education, we call it the ABC model, the antecedent,
Okay.
the behavior, and the consequence. Well, when we're into anxiety, there are some triggers that perhaps exist that our kids might not even know. A really great trigger for some kids is test. We have what we call test anxiety. And when that test is looming in their minds and they sit down, they've studied all night long. And then they get to the test and they have this overload, this sense of stress hits, then the trigger hits, and then the anxiety hits. And then that anxiety somewhat impacts their working memory, which means pulling up all of those facts that perhaps they had studied, they feel like they've just lost it and it's gone out. So those can be some of the triggers also. Moving into crowds, for some kids being in crowded hallways when bell changes, or sometimes hearing bells. If you have some students that perhaps have autism, that could be a trigger and that could cause some anxiety for them. But some of the things that we have listed, excessive worry or fear of everyday events. And I will say to you that pre-COVID, I don't feel as though we had as many triggers as perhaps that we have now with being in the COVID moment. So people who probably could have gone out into large crowds, you're not doing large crowds now. So, I feel like when we move back into a space where we are past COVID, how are people going to feel when you're out and about and you don't have to wear your mask and you're in a large crowd of a football game? How is that? Are you going to have any triggers with that? So those are some of the things we're going to have to ease back into. Not sleeping or having nightmares can be triggers for our students. Difficulty concentrating or staying focused. A lot of times negative thoughts, because negative thoughts, that can move you into a space where you move into the fear. And we have to talk about anxiety because anxiety really is fear-based. It's a fear-based emotion that we have when we feel that something we can't control or something is going to conquer us. So it is fear-based. Also harming oneself or objects, and a child that's having sudden cleanliness or constantly crying. Those are some of those triggers that we need to know as parents that something is different about our child.
Oh, wow. How can it impact you? How can it impact the person?
Wow. So, when we look at here, we talk about intense fears and distress. But when I think about students, stress and anxiety can impact our students in so many ways. It can impact their work performance, their test performance, their interpersonal relation skills, their irritability, not wanting to get out of the bed because, we're going to move into talking about depression, but we have what we call comorbidity. Sometimes when you can have more than one disorder or diagnosis at the same time. So sometimes we may have some students that have ADHD and it's hard for them to navigate this world because our brain is a predictor model, and we're dealing in COVID-19 where we're fighting the invisible beast. So you don't know what you're going into and what you see and what you don't see. So the brain is a predictor model. It's if this, then that. Well, that's somewhat changed now. So that too can bring on some anxiety. So when we think about our children now in school, even moving from our virtual mode to some of them moving into the hybrid model, 2 days a week and
Yes.
2 days virtual, that too may cause some anxiety. So, we're having our teachers to somewhat put, as I say, the third eye on our students who may need some assistance within our school for those of us who can provide some level of services just for re-entry back into school.
So what can we do to support our child if they're experiencing
Right. So
anxiety?
I think one of the things that our students I think there may be a lot of students who are going to be really happy to get back into the classroom because it's going to provide some structure. It's going to have boundaries. Even I think as an adult, when I was working virtually, trying to keep my boundaries clear, and this is probably just personal information, but I would be trying to do my work, and in the back of my mind, I was thinking, there are a load of clothes I probably could put in on my lunch break. So I'm gonna put these load of clothes in, and then I'm gonna come back to work. Well, for kids, there's no boundaries when you're at home doing virtual. So getting back into school could be a very good thing, but it might be anxiety producing as well for them because you've got to relearn that structure. We've been out more than that 3-month time period. So recognizing and helping your child to know what their triggers are, helping them to take deep breaths. I work more on the middle and high school zone where a lot of students have their telephones, and there's so many calming apps that you can do to support anxiety, just helping them to organize their thoughts, helping them to organize and plan for tests and projects. That phone can do a lot of things to help them. Talking to someone, for students, it is great for them to talk to their peers because, that's great socialization. But when it comes into moving into anxiety and or depression, you probably need someone that has a little bit more wisdom and a little bit more training to help them deal with those feelings. So perhaps using your school counselor, using your school psychologist, using your school social worker, and other support people in your building to help you process those feelings. It's so important to eat a well-balanced meal. It's so important to get your sleep cycle straight, making sure you have something to look forward to that you're enjoying, and just taking some time out just to understand that this is a process as we're moving back into the building, and to sort of take one day at a time.
Okay. Well, we're going to stop right now and do a pulse check to see if there are any questions or questions that need to be answered. Lisa, are we good? No questions? Okay, well, we're going to move along, but I do want to remind you that we do have a Q&A. You can answer if you have any questions throughout this presentation. Just put it in the Q&A section, and we'll answer that for you.
Eunice, we do actually have a question that just came in. It says,
okay.
My child, when a child is upset, picks at their skin. Is that a sign of anxiety, and what can they do to help that?
Marie, do you want to answer that one? Because I'm sure that you have experienced that at Kimsville.
So I would say that a child that, and just so I clarify, so I heard that correctly, you said a child that's picking at their skin, is that correct?
Yes.
Okay, so I would say in that particular instance, that could be a nervous twitch, or it could be something that is a way as a coping mechanism for them. I notice with a lot of children who have anxiety, they will they'll peel their nails or they'll pick at their skin to the point of causing even maybe a scab or possibly an open sore or something of that sort. I would just monitor that, make sure that you watch your kiddo and see if that's something that they're doing on a regular basis. If it's something as simple as tearing their nails or nail biting,
Mm-hmm.
if you use the bitter apple nail polish, for instance, and they continue to do it even with that taste because it's a way for them to fidget and kind of use as a coping skill, then at that point I would probably say that yes, that could very well be a sign of anxiety. That's a point that I would have just a simple conversation, especially if your kiddos are younger, to kind of get them to tell you like when it is that they want to do that or why they feel compelled to do it. I know, for an example, you know, with my son, especially when we were traveling in the car, like when we would go on long road trips, one of the things that he would do would mess with his nails. And it was just him, you know, obviously having anxiety about being in the car for a long period of time and traveling so far. So, I mean, there are some things that, you know, as long as you communicate with your child and have that conversation with them and find out when it is that they're doing it or what is triggering them to do it, there are little simple things that you can do to avoid that. So one of the things that we would do before we would get ready for a car trip is say, hey, we're getting ready to do this. I'd like to sit and play cards with you in the back seat, and plan ahead to try to help alleviate some of the anxiety that they might be feeling. That's just one example. There's obviously there's many more out there, but I would say that if it's something that you see repetitive over and over and over again over a period of time and isn't just a one and done kind of thing, then yes, I would say that that is a sign of it, and it would behoove you then at that point to have a conversation with them and try to figure out what those triggers are and see if you can then combat that with another positive reinforcement or a positive activity instead.
So I see we have a question. I was going to answer this, Ms. Brown, from Ms. Barton, that's talking about her child having panic attacks. When she hears someone else coughing, she panics and thinks she will get sick. I try to relax her by telling her to take breaths. Any suggestions? So one of the things, you know, that I use a lot when I'm with students who may be moving into that direction, we call it the countdown. I will say to them, tell me 5 things you can see. Because when they start concentrating on things outside of that moment, it helps them sort of kind of regulate their breathing. Then tell me 4 things that you can hear. Then tell me 3 things you think you can touch. Then tell me 2 things you think you could taste. And tell me 1 thing you really like in the room, because that somewhat changes their mindset on what's going on in that moment. So the thing that I'm seeing this with your child about when someone else is coughing, I'm wondering if that is something that has developed over the COVID period. And I think talking to her about what makes her anxious during that moment, and if there's been some experience in your family with someone that's been ill, but having her to understand that, you know, people have allergies and they're going to cough. You know, not everyone that has a cough is necessarily going to be someone that has been impacted by COVID-19. But helping her to understand what that trigger is, what it means for her, the fear of it, because I think it is just the fear of her thinking that she would get sick. So having her do that countdown, but also try to have a replacement behavior. We try to do those in the school systems, do replacement behaviors. So when she's around someone that is coughing, perhaps her best measure is to remove herself from that space immediately, because if she stays in that space, then that continues her anxiety. So perhaps doing the countdown, having her to remove herself from that space just to give her some time to stop and think, and some type of replacement behavior. You know, we got all of these little scrunchy balls and things like that perhaps she can move her anxiety into.
Let's do 2 more questions and then we'll move on. The next one is, what's the difference between utilizing the school counselor versus a military counselor or someone else assigned to the school? Which one is professionally better suited with dealing with anxiety? And then I have one more that I'm going to deal with right now. It's asking, how do you teach your child to recognize his or her feelings? For example, if she's feeling nauseated or has a headache, but she doesn't feel sad, but she feels sick. How do you recognize the difference between anxiety and actually being ill?
Okay, so Marie, maybe I'll take the first one with the school counselor versus military, and you could take the second one. Okay, so let's talk about schools. Schools are institutions of education, and we're not mental health facilities. So school counselors, school psychologists, school social workers, we are not licensed to do mental health counseling. So when you're talking about a student who has a medical diagnosis that's come perhaps from a psychiatrist, a pediatrician, something that has a medical basis, to a licensed clinical social worker, we as school officials do not do therapeutic interventions that involve medical diagnosis. We can do interventions that are school-based to help them move through their school moments and their, their educational career. But when it speaks to the actual mental health counseling, we are not licensed professionals to do so and are not governed by the state. So that answers that question. So if it is a child that truly has an anxiety disorder, and there are, if you're going through Navy Portsmouth facilities, and they have people there that are certified through, and it's also an insurance issue. You know, you have to have someone that is licensed to cover it through your insurance. So school-based will be those persons who can help with anxiety, but if it's landing in the school, you know, helping, you know, with test taking, studying skills, organization. But once it moves into that medical field with a medical diagnosis, it would be most beneficial probably on the family side to move on that side.
And can you go back, Lisa, and tell me what the age of the child was that you were referring to?
They didn't specify, it's actually 7 years old, 7 years old.
So in that particular instance, I would incorporate what we call FACES. And there's actually, you can look it up online without too much difficulty. There's actually several different apps that have it as well, that have different faces, facial expressions. One has a smiley face, one's a straight line, one's a happy face. One looks like it, you know, the person looks like they're about to vomit. Not to be too graphic, but to give you an idea, there are many different faces to choose from. I would say for a child that is that age, I would actually utilize that and ask them if they can tell you, especially if they're saying they have headaches or they're nauseous. One, to ask them exactly where their headache is. If they said, oh, it just hurts all over. That's very different from being able to say, well, it hurts here at the base of my head, or it hurts here on my temple. Things of that sort. Or if they say, I'm feeling nauseous, well, do you feel like you are going to throw up, or do you feel like you need to use the bathroom? What is, you know, see if they can pinpoint it for you. So that's one thing. If they're not able to pinpoint it, then utilize that face sheet that I just described to actually tell you exactly how they're feeling. And it's a little bit more descriptive of saying, oh, I'm happy, oh, I'm sad. It goes a little bit more in description. And it's really important, especially for children and adolescents, to really be more descriptive with how they're feeling. A lot of times we as adults sometimes will say, oh, I'm fine. That's not necessarily how we're feeling in the moment. That's not truly a descriptor of how we're feeling. We utilize that as a, okay, stop talking to me. I need to do something else. I'm fine. When really we're not fine at all. You know, I could be an emotional train wreck on the inside, and maybe I've just recently lost my dog and I'm not dealing with it well, or something of that nature. So I would definitely say incorporate that FACES sheet, and then also ask your kiddo to be really specific about how they're feeling. One of the things that we're going to talk about too, when we get to the point with regards to depression, is that there are some very similar symptomology between anxiety and depression. And we'll also talk about a little bit more with comorbidity as well. But hopefully that does at least help you, give you a starting point. And if it's beyond that, you know, it's beyond the faces, it's beyond them being able to give you an actual descriptive as far as where my headache is, things of that sort. That's the point that I would start to communicate then with the folks that you're working with at school, or maybe other people that have interactions with your child on a regular basis, just to see if she's experiencing those same things outside of the home, and be able to then kind of decide, okay, is it this the point in time I need to actually go and have a conversation with somebody like a counselor, or maybe the pediatrician even, to see if maybe there's a physical ailment.
Okay, and before we go, we got one more question that I want to ask. And I'm sorry. This one is in reference to the transition between going from one school middle to going to the high school. And a lot of times they have freshman orientation and things of that nature. Well, because of COVID, we didn't have that normal freshman orientation, getting to know the school. How do you recommend parents talking to their children about the anxiety of being in a new building, being in another setting during this COVID situation?
Right. So I will speak to that because I am one that works in a middle school and a high school. So I know exactly what the parents are saying. The one thing, though, that I think may help in this situation is that we are bringing students back by grade levels. So they will not be moving back into a totally student-based setting where we're bringing back the ninth graders at one point and then bringing back the other grades. So I think helping them to understand that they'll be going back in smaller numbers, that once they get there, even though they'll be, you know, in their classes, that sort of kind of helps regulate them, that they'll see their friends again, that they'll be in some of these classes. And that piece, I think, and it's funny, once they get with their friends, some of those other feelings that they have, they just sort of kind of dissipate. And you wonder, like, where did all of that go? But our kids regulate themselves with our kids. How about that? So, we think about being virtual. And, I was saying this to a parent in another meeting, that our children use each other to regulate what they're doing. Like, say, for instance, you're in class and your teacher's talking and your child has drifted off, but they see everybody closing their book. And it's like, oh, I guess this subject is over. Let me close my book. Well, when you're at home virtually and you've sort of kind of floated off, you don't know that the subject content has changed. So a lot of times we will self-regulate ourselves just by visual prompting. So helping your child to understand that we understand. School officials, no, we know that they're coming back and there's some anxiety producing moments, but we're doing what we think will help them land safely. We know some of them will helicopter and they'll go around and around and around before they move. But we're hoping that with all of the strategies that we have been putting into place, it will help them to move in very safely and calmly.
Well, thank you. We're going to move on. We're going to talk about depression. Marie, let's get started with, could you at least tell us what depression is?
Sure. So to define depression, the individual must be experiencing 5 or more symptoms during the same 2-week period, and at least one of the symptoms should either be depressed mood or a loss of interest or pleasure. And I do want to emphasize the importance of a 2-week period. Because I know, we've had these discussions before, a kiddo, their experiences can evoke different emotions, and depending on what their life experiences are, how they respond to things. So for example, and I used this example earlier, if a child were to lose a pet, some children, that could be extremely traumatic for them. But for other folks, it might not be as traumatic because maybe they weren't attached to that cat or whatever the case may be. So I do want to point out that it is important to understand that they must be experiencing 5 or more symptoms during the 2-week period. And at least one of those symptoms has to be depressed mood or loss of interest or pleasure.
Could you describe to us what it feels like to have depression?
So I don't necessarily know that I can describe it per se, but I will say that as far as causes of depression, we see, hormones and brain chemistry, those inherited traits that are listed on our slide in front of us, those are really biological things. So those are things that we really don't have a whole lot of control over per se. The other side of the slide talks about early childhood trauma and then learning negative thought patterns and things of that nature. Those are the 2 things that I think we as parents really have to be on the lookout for. Again, I kind of mentioned just a moment ago with regards to traumatic situations. We have to realize that trauma is experienced by people differently. So what could be a big T trauma would be the sudden death of a loved one, and could be extremely traumatic for the family, could throw the child obviously into a little bit of chaos because that individual is not there any longer, and then also maybe wanting to be the nurturer for the parents or other siblings, things of that nature. The other thing could be what we would consider a little T or a little trauma, might be a kiddo that just experienced a breakup for the first time. So it could be the breakup of a boyfriend or a girlfriend or things of that nature. So we as adults would respond to those things differently, obviously because of our development and maturity, but then also too, to them, it could be their entire world. So we really have to be very thoughtful and respectful of where an individual is and their vulnerability in that moment. And I think that, knowing that up front before you have your conversation with your kiddo is super important. Now, going back to the biological pieces, as far as causes are concerned, there is definitely, obviously, prescriptions as well as therapy and things of that sort we can talk about a little bit more in depth later on. But there are things that are available out there now. And I think one of the biggest things that we are starting to see in the mental health realm is a shift in the mindset with regards to the stigma of mental health and mental wellness. I encourage you, if you are experiencing symptomology, and we're going to get ready to talk about that, of depression, that you definitely be open to the possibility of seeking assistance, whether it's through pharmaceuticals, therapy, a combination of all of the above, but know that there is help out there.
Okay, could you go a little bit more into then the symptoms, as far as the behavior and the emotional changes that we'll see?
Sure. So you're going to see in your kiddo a possible loss of energy. This is the kiddo too that is probably not going to be able to sleep well at night. I have had this conversation with several other professionals in the past that if I could get rid of one thing, it would be social media. Because we've gotten, addicted to the point that we hear our phone ding and we automatically pick it up. We're just trained to that now. So insomnia is a really big issue. So even though you might have rules in your home that, there's no phone time or no iPad or no computer time an hour before bed, this kiddo is probably still going to have difficulty sleeping and staying asleep through the night. You might also see them actually have issues with being slow in activity. So they may not be as perky as they normally like. They used to be like, "Woo, let's go and get out the door. I'm ready to go to school." Whereas now they're just like, "Okay, it is all I can do to get out of bed and get my teeth brushed so that I can maybe make it to school by 30 minutes late." So really, you've got to watch out for that. I would also, talk about the alcohol and drug use. It's not something that any of us want to have a conversation with as a parent or hear that our child may or may not be involved with. But if you do find that that is the case, that could very well be utilized as a coping strategy by that kid to just not, to dull the pain so they're not having to deal with whatever they're struggling with. Other things are agitation, of course, social isolation. I mean, we have experienced so much with COVID already. If the kiddo is just not wanting to engage with any of their peers or be around their peers, for whatever reason, especially that, late middle school, high school age, if that's happening, those are red flags for us. And then also poor school performance. I say that very loosely in the fact that if your kiddo is struggling academically with something, that doesn't mean that they might have depression. I'm not saying that at all. What I am saying is that if they were typically, an A, B student and all of a sudden their grades drop, they're not interested in academics any longer, they're not wanting to participate, those can be red flags for us. I do want to mention very quickly, and you'll see that on the slide, that there are possible thoughts of suicide. That is not a given, and that is not definitive. That means that that doesn't necessarily have to be in play in order for a kiddo to be depressed. So again, the struggle with those sleep patterns, rest, loss of concentration. You may even see some weight loss or weight gain, and it be dramatic. Also, I would go back to the emotional piece, that self-deprecating comments that, good enough, I'm not pretty enough, I'm not fat enough, I'm fat, I'm stupid. So things like that, we really have to work on self-talk and what we say to ourselves, and not just outside so that somebody else can hear. I know, especially with a lot of girls, they are more tempted to write something down in a journal or even draw out how they're feeling more so than boys. But sometimes they'll say or make little notes to themselves, and write the word stupid or write the word idiot or whatever the case may be. So please, keep that in mind as well. I think the other thing that you'll find along with the low self-esteem is maybe fixation on failures. And this can be anything that's currently going on for them or things that have happened in the past. So if they were embarrassed by something or something didn't go, like a science project didn't go as they had planned, and it was a presentation in front of the entire class and it just didn't go like they wanted it to, like they're still fixated on it, 30 days later or 60 days later, like that was so dumb of me, whatever the case may be. So the fixation on that. I would also say, you know, they're very sensitive and also very responsive. Like if something is said to them and they don't like it, that they'll bite, what we call bite back, or throw it back at you, whatever the case may be. And maybe that particular individual, that's not their norm. I say this to parents a lot, or when we do presentations as well. You know your kid better than anybody else. So if they're not acting like themselves or something just doesn't feel right, trust your gut and go with your intuition. That is a great cursor of being able to relay information and then to start the conversation. Communication is so very, very important, and we'll talk about that some more.
Well, if we have a child that we feel is depressed, how can we support them?
So this leads me right into the communication piece. I can't emphasize communication enough. And we have to learn how to communicate with our kids now. Our kids don't come with manuals to tell us, this is how this is going to go today. And gosh, if that had happened, that would have made my life a lot easier. But that's not the way the world works. So we really have to learn what is the best mode of communication. I know in our household, it is literally having a conversation and literally talking to one another. I know some folks, they would prefer to text because that's how they talk to their teenager. Sure, that's great, but I think the good old maybe utilizing that text conversation to then have a physical in-face conversation is super important. So, and having a rapport with your kiddo to be able to ask them the tough questions. If you know that your kid has a really good relationship with a teacher at school or a coach or maybe their dance instructor or their chess instructor, whatever the case may be, talking to them as well and saying, hey, I've just noticed that maybe Julie's not quite herself lately and she kind of just is keeping to herself and she's not talking to me. Has she mentioned anything to you that might be going on? So I really do think having that rapport, not only with your child, but the people that are involved in your child's life is so very, very important. I would also say just as important is that if your child does express themselves and is able to say, okay, this is how I'm feeling, no matter if it's what you want to hear or not, that you need to be supportive of them so that they understand that it's okay to not be okay, that to validate where they are in that moment, and that you're going to be there beside them and walk through this with them and take care of them. They need to know that. So I think that that's super important. I would say too, making sure that you do the simple things like working with them on their sleep, making sure they're eating nutritious meals, making sure they're consuming enough water. Dehydration is something that we don't talk enough about in this country. And I won't get on my soapbox about it too much, but it's so very important that we not only fuel our bodies appropriately, but we also hydrate them as well. And then also making sure that they're able to identify good things that happen every day or good people that they've come in contact with, and to not dwell on negative stuff. And then of course, I keep coming back to the communication, being able to express themselves with you openly, and not feeling like they're being judged when they do share. And if they're not comfortable talking with you, I know this is hard for teenagers. It was a really difficult issue with my son sometimes, getting him to tell me what the heck was going on. Know that there are other people that he's having conversations with. And if you're a part of that group, finding out from his teachers or coaches or whatever, what might be happening and being able to address the issue. And then if needed, if those things that we just talked about, they're not quite enough, understanding that there are therapeutic options out there that can help support your child as well.
Okay, well, we have 2 questions. Lisa, can you give us the questions?
Sure thing. How do you combat kids becoming overly attached or reliant on their friends?
Okay, so I can start off with that one. And I'm wondering, I'm not sure if this is pre-COVID or if this is during COVID. But again, sometimes when our our children or our students are relying on other kids, it might be a mechanism for them to self-regulate. It gives them something to, I guess, attach to and something to give them to look forward to. So I'm not sure what the reliance piece is, but I think also what you have to figure out is, why is it that your child is looking outside of self for validation? Is there some things, some strength, what we call strength-based assessments? Tell me about some strengths that your child has. They might be an arts and crafts child, and they can do really, really great arts and crafts. And maybe you can bring those friends over for that child to show them arts and crafts. Or maybe they are great with their hands, or they've got a garden. Because I think what happens is our children get fixated with other kids because of what they're doing, because we haven't validated that the things that they're doing are important and great as well. So sometimes you've got to flip it and say, okay, well, if you know, this reliance that you have on your friends, let's see if we can bring them over and you do a cooking class. Because you know, you make some great spaghetti. You know, sometimes we've got to find their strengths and try to help them to understand that they don't have to pour their lives into somebody else, but I mean, have their lives into somebody else, but they have strengths that they can share with other kids as well. And I don't know, Marie, if you have anything else to add to that.
No, I think it's really important to encourage positive talk. And in a lot of cases, as you just said, Tawana, kids will look for validation in other people if they are not feeling it within themselves. So yeah. I definitely think that the positive talk is, I mean, something as simple as just putting an index card on the bathroom mirror that says you're awesome. You know, label off 3 things that you're thankful for. You know, or today is an awesome, you know, today is going to be an awesome day. And here's 3 reasons why, and then have them tell you 3 reasons why today's going to be awesome. So again, it depends on the age of the child. I think, you know, something as simple as, you know, putting that sticky note on the bathroom mirror can be your message to your kid, but then can also encourage a conversation with maybe even a younger child to discuss what it is that makes them happy. I think we, unfortunately, as a society, and I feel like I can say this without too much reservation, is that we've gotten so consumed with what's going on with everyone else, and that we are, because of social media and the internet and being connected to stuff all the time, that sometimes we really do kind of need to de-escalate and remove or disengage ourselves and remove ourselves from media and news and things of that sort, and really connect with what's important to us. And making sure that we are validated, but then also the ones that we love the most are validated as well.
I can just share one thing. As an adult, like right now in my own life, I have what I call a joy jar. And anytime I have a moment that is joyous to me, I write about it and I put it in my joy jar. So then when I'm having a low moment, I can go into my joy jar and pull it out, and I have this immediate sense of joy because it takes me back to that moment. So sometimes getting kids to have joy jars, or you can have a family joy jar. Everybody puts something in, and then at dinner, everybody just pulls one out and they pull it out and you say, oh, your joy moment was. But sometimes we've got to go back to joy. That you might not be in the present moment of joy, but you got to go back to a joyous moment and have that sort of kind of refuel you.
Oh, wow.
That's a great idea.
It is a great idea.
We have one more. What about a fixation on other people's wrongs? She says her child fixates on all the wrong things that people around her do, even weeks or months later. So how do you handle something like that?
So I guess I'm gonna start off. I think, again, you know, it goes back to what Marie called the positive talk, or what I call strength-based assessments. And getting, you know, because, you know, the concern that I have is that if that child has mastered their way of recognizing people's negatives, we need to flip that to have her to recognize people's strengths and to have that positive talk, as Marie said. So I think helping, you know, that the child says, well, so-and-so did this wrong. Say, well, can you tell me one thing they did right today? And you sort of kind of encourage that conversation to be in the positive mode instead of negatively reinforcing the negative. Because, you know, sometimes for us, kids will do all types of things just to have a relationship. You know, and I talk about this a lot with my high school students who may be having relationship issues between their romantic interests. And I say to them, you know, that negative text you got was still a relationship because you still communicated back. So sometimes we've got to figure out what is the driving force and purpose when we have negative confrontation or negative conversations, because it still keeps that fuel going. But again, trying to help your child to understand that, you know, all of us have our negatives and all of us have our positives. If you could flip that script and say, okay, so tell me one thing that person did great today, and then move the conversation daily to tell me some things that happened that was great in your art class. Tell me, because you've got to change that mode of thinking to a positive sense more than to that negative mindset.
Wow.
Absolutely.
Okay,
I agree with that wholeheartedly. And I would add to that, that when you have that conversation and ask them that positive piece about the other individual, once they've completed that question or answered that for you, if you need another question to ask them at that point to keep the conversation going, is ask them something positive that they did that day or something that they're proud of that they accomplished that day, and then turn the conversation back to them. It's really kind of putting the lens on themselves as well. And I think it's helpful to create that positive talk for themselves as well as others.
Okay, well, let's move on, because now we're going to pull it all together. We're going to look at how anxiety and depression fit together. Can you please share with us?
So as I had mentioned earlier, both of these issues unfortunately tend to run hand in hand. And they can obviously be independent of one another, or they can actually come together. So it can occur, depression can occur when anxiety already exists. And you'll notice, as you saw probably on some of the slides previously, and even heard Tawana and I speak, that we listed some of the symptoms that you will see. Some of the symptomologies may be very similar, whether it's a headache, or it's a fear about something, or it could be something about as far as like isolating themselves from situations and or peers. People who suffer from depression also do experience worry and fear. That's not uncommon. And you will find, especially with those that have experienced some traumatic events, those individuals are usually prone to depression. There is something out there, if you have a chance to look it up, not to go into any great detail, but there was a wonderful longitudinal study that is continuing on. It's called the ACEs, and that is ACE, and it stands for Adverse Childhood Experiences. That particular study actually looked at children who had traumatic events in their early life, and the fact that it then ultimately led to physical ailments as they got older. So anything from diabetes to cancer to heart disease to whatever. And we could go into this very deeply, but I don't want to take too much of your time on it. But we do know that traumatic experiences, depending on where an individual is, and what their experiences have been and how they respond to it or don't respond to it, can be different for each individual person. However, traumatic experiences can be defined as something as horrific as a death. It could be something like domestic violence. It could be drug use. It could be something like a car accident. Again, the loss of a pet, something, you know, as traumatic as it can be, of not having dinner, not knowing where my next meal is going to come from, whether or not I'm going to have shelter when I get home from school today, things of that sort. So those can be traumatic experiences, and typically, as carried, will then, of course, turn unfortunately into depression. Doesn't always happen, please know that, but they are prone to experience that. Biological predispositions can root, again, there's hormonal things, could be genetics. You know, if you have a line of depression in your family and you're aware of that, it is possible that your child will have that as well. Again, just being very cognizant of that and understanding that if that does happen, you know, if you start to see some of these signs, then you want to go ahead and start having these discussions, not only with your child, but again, that system of folks that are around your kiddo on a regular basis, just so that you can take the appropriate steps if needed to go down a therapeutic realm or a medical realm if necessary.
Well, what should you do if you feel like your child is experiencing anxiety and depression?
So I want to piggyback on Marie when she was talking before we get into this about the adverse childhood experiences. So we do have some psychologists and some school social workers who are trainers of the adverse childhood experience trainer model. We call it the training informed school care model. And we have gone out into schools and we've done that training across the division. We've done it with our school counselors. So we are very aware of our adverse childhood experiences and how that impacts within the children, and teachers are aware of that within the school setting. So that is something that I'm proud that the division has worked on and continuing to provide training on. So when we look about, what should parents do if their child is experiencing anxiety or depression, these are some of the things we want you to do. It's first of all to help your child manage the stressors. But I think the first thing as parents you have to indicate is it a stressor for your child? Because, sometimes our children will mimic other children in class when they have stressors. And we have to figure out, is it truly an identifiable stressor for them? Or was it something that perhaps they saw one of their peers have a little stressful moment? The teacher gave them a whole lot of warm and fuzzies. They went to see the counselor, it was a lot of warm and fuzzies. And they were like, oh, I can get a little attention. So we have to figure out if those stresses are really validated for them. When we say don't avoid the anxiety or depression, we're meaning if you're starting to see some of those symptoms that we've talked about, please don't avoid them. Please have some conversations. Please have that positive talk. Please even, keep a little journal yourself. When your child is starting to have any of these symptoms, it's great to even put it on the calendar. Johnny had little anxiety and it's Monday. And then you do another one and you find out it's Monday. And then the next week and you're like, oh, well, maybe he's come home for the weekend, he's had a great time, and then reintroducing himself back into the school on Mondays are triggers for him. Or perhaps it's on Fridays because I'm not going to see my friends or my teachers. So sometimes even keeping a journal, when you're starting to see those types of behaviors, you can almost perhaps get a pattern of behavior yourself just visually. And then expecting and expressing positive expectations. Our children do have stressors, but it's all about positive talk. And it's also about them understanding, as Marie said, that they are resilient and that they have some what I call push through skills, that sometimes they have to learn how to push through, because we don't want to coddle our children every time they come across a hurdle that perhaps seems a little bit high for them. But again, if some of these symptomologies move and that is impacting their daily life functionings, their work, their relationships, their decision making, their problem solving skills, that's when we move into a different tier of assistance.
And I would go right along with that, respecting their feelings and empowering them. So going back to what we mentioned before with being supportive when they express their feelings, giving them validation, and even saying to them, there's sometimes that I feel X, Y, Z, and this is how I handle it. Or saying to them, it's okay to not be okay. Again, giving them that support so that they know that they can come to you at any point in time and have these conversations. And that then will empower them to continue to have these conversations with you. And then also, hopefully, once the positive talk starts and you are able to work through some of that, you can make some behavioral modifications and actual changes. The other thing is obviously encouraging your child to build resilience. I love the idea of the hurdle, because it is. There are certain experiences that we have in life that are just seem like they're a little bit further out of reach than what we can do. But you know as a parent that your child's not going to learn to walk without crawling first, and we also know that they're not going to walk without falling down. So being supportive of them and trying to help them up, but then also giving them the freedom and the empowerment to be able to help themselves up as well. So knowing to encourage to help build that resiliency. Now, I will say too, if you do have a kiddo that is experiencing physical ailments or is telling you that my stomach's hurting on a regular basis and I've got headaches and things of that sort, that there may actually be an actual physical ailment of some sort, and not to ignore that. And that's a point when obviously you would have a conversation with your primary care provider. But if it is beyond that, and you know that this is anxiety related, I'm able to see that on Mondays, I know he is not going to want to go to school, or maybe it's anxiety for visitation with a parent, or it could be anxiety with regards to a certain class. Maybe they don't like chemistry. They don't like the chemistry teacher. So all of a sudden they're in the nurse's office in high school and they haven't had this problem before, and they've got headaches all the time, things of that sort. If that's a hurdle that they can't get over and you've tried to assist them and you're not able to get that, that's the point when you need to have conversations then with outside professional providers that can help you.
Wow. Well, can you talk about some treatment options?
Sure. So as far as therapeutic options, we talked a lot about obviously talk therapy, which is cognitive behavioral therapy. That's pretty much where you sit down with the therapist and you have a conversation and kind of go from there. There are also other modalities. So if you have a younger child and it's really hard for them to express themselves and you're just not able to get them to express themselves in a way that you're able to understand or possibly follow through with, for whatever reason, there are other modalities, art therapy being one of them, play therapy being another. We have found play therapy and art therapy to be very, very helpful, especially with those kiddos that are able to express themselves in a way through art that they're not able to do verbally, maybe in conversation, or not wanting to do via conversation. Art therapy is a wonderful tool to be able to really depict how an individual is feeling and kind of walking through that. And then, of course, as I said, the younger kiddos, sometimes play therapy really gives us the ability to kind of get to the nitty gritty of what it is that's a trigger for them. And by doing it in a way that's playful, it's not necessarily in their mind therapy as it is them sitting down playing with toys and you kind of helping to navigate through that conversation. I would say that those modalities are typically the three that we see utilized the most in the mental health field. There are other didactic and a couple other forms of therapy that are out there, a lot more complicated and a lot more descriptive, and we could have a presentation on just the different modalities that are out there. But I would say the three that I mentioned previously, the CBT, which is the cognitive behavioral therapy, talk therapy, play therapy, and art are the three most utilized.
And so I'll talk about the school entry. And the reason that we did put that is that on some occasions, we do have students who do need a more intensive means of having therapeutic interventions to the point that they perhaps may have to have hospitalization. That could be from a 3 to 6 day stay or may perhaps longer than that. So in the event that you have your child has been through the hospitalization process, they've gotten a discharge summary, they perhaps have a diagnosis, we are moving through a process within our school system where we'll have a school reentry plan where we would actually have some sort of support for your child. So, people on that plan would be the school nurse. Suppose your child has to have medication and it's something that's done, twice a day and the school nurse needs to know. Also, just to have some support systems in to talk about, are we going to gradually phase your child back into the classroom with perhaps a hybrid model of which we're on now, where we're making sure that they're getting their assignments. We're making sure that perhaps assignments might be reduced at a point just to make sure that we're getting quality of work versus quantity of work. Perhaps when we're doing their tests, perhaps they need to have a little bit more time in doing so. So if you have a child who goes through that process and there is a hospitalization, we're asking that you let someone in the school environment know so that we could develop a plan so that we can support them that's coming from that setting where they're getting a lot of attention for perhaps their mental concerns and emotional concerns and social emotional concerns, and that level of concern does not just drop. So please let someone in the school, your school assignment know what's going on with your students so that we can move through a process to give them that support, that bridge back into the classroom.
Thank you, Tawana. We have 2 questions.
Yes. How do you get a 14-year-old to know the importance of exercise? Is there an opportunity for schools to encourage physical movement at the end of the beginning of bells? I guess they're doing school virtually, and if they were in school, they would be getting up, going to the next bell. Now that that's not happening, what could you recommend or encourage families to do at home?
Okay, so the one thing that I think about with a 14-year-old, 14 is that tricky age, because that is that I'm almost going to high school age, and I'm almost in control of my new life. So 14 is a tricky age. But the one thing that I think about when you talk about exercise and hydration and good nutrition is perhaps on a calendar, you ask for your 14-year-old to do one of those three things a day. And if there's a level of success, they get a check. And it's almost like a behavior chart. And then the next week we ask them to do perhaps two of those things a day. And then the next time to do three of those things a day. But I think what you have to do, first of all, is to get the buy-in, to help them to understand what the physicalities does for them, what walking does for them, what eating does for them, and what it does not do. So sometimes we do have to be a little cerebral in our approach and show them some documentation and some research that says when you don't fuel your body, it's like a car without gas. It just doesn't run. It just doesn't run. So having that conversation, and if they have a cell phone, tell them to Google what happens to my body when I do not drink water. What happens to my body when I do drink water? So you've got to get that buy-in and perhaps do a behavior chart that have them to self-motivate and to self-record what it is that they're doing to help them understand that they can be in charge of something of their life.
Okay, Lisa?
Yeah, we have one more question. Do you recommend yoga for a young teenager to assist with anxiety or depression?
So I would say yes.
Absolutely.
I think any time that you can encourage movement, I think it's great. And the wonderful thing about yoga is that there is an entry into the meditation point. There is the yoga practice itself, and then there's an exit point as well at the end of the yoga practice. So I would say that absolutely. I also will throw in there that there are apps that, if it's not feasible for you to go to a yoga studio or participate, and I will say this with the caveat that this is something that the kiddo needs to want to do, not something that you're forcing them to do. Again, that buy-in is super important. But giving them the option, if we do one of these three things and then let them select one of the three, then like Tawana said, you get a check mark, and after you get a certain number of check marks in the month, you can have money towards a video game, or you can, whatever the case may be. I'm just throwing that out there as an idea. But I definitely think that the mindfulness practice of yoga is very helpful. It can be very helpful. It's hard for us. Human beings do not sit still very well, and we are and don't expect them to. I would throw this out there with caution. Yoga is wonderful, and the mindfulness piece is wonderful, but you are not going to quiet your mind the first time you sit down to do it. It's just not feasible. If you do, you're a yogi right away, and that is a blessing. But that's very, very rare. But it's a practice that once you get into, if you are able to participate with it actively on a regular basis, you can get to the point where you can sit still quietly. I have done mindfulness for a long time, and I still have a hard time sitting still. I'm sure you've seen during this presentation, or if you've seen my face, I'm kind of all over the place, and that's just me. I fidget a lot, and it's something that I know that I do. Sometimes I handle it a little bit more gracefully than others, but I would say a practice of yoga or mindfulness is definitely encouraged. If mindfulness is really what you're going for instead of the actual act of yoga, there are quite a few apps that are out there. There are Calm apps. You can literally just look it up in the Apple Store that are out there that can be utilized for that and can ease you into the practice of that over a period of time. So
thank you. That was another question that someone asked. That's really good. And I know Eunice is very good about that. She's always talking about calming mechanisms and things of that nature. So I know that's something near and
I
dear.
have my little bells here.
Yes, yes.
Miss Brown, before you move forward, I wanted to go back to a question that was posed by a parent and we missed
Yes.
it. And I just want
Okay.
to go back to that. So
Okay.
it was a parent who was indicating that her child was autistic, but going through some mood changes. And she
Yes.
wanted to know, she wanted to know if that was an anxiety disorder. And as we know, autistic children see the world differently. They process the world differently. And I would think now that we're on this whole virtual education, again, all of the social cues that perhaps even our autistic students, they still read social cues. It may be on a limited variation. But I would think that it probably is more anxious behaviors than perhaps a diagnosis of anxiety at this time, just because the level of predictability is out the window. And we know that our students that are autistic need to know everything on a predictable level. We know we have visual charts in our classrooms where they perhaps move, okay, now I've finished English and I'm moving to science, or now I'm finished art and I'm getting ready to go to PE. We have all of those social cues that we provide to them that they're not able to get at this point. So the anxious behaviors, perhaps your child is about to move back into the school setting, and that fear of not knowing, again, having to self-regulate again with all of those new changes. So perhaps talking to your child about what school is going to look like. I'm not sure if you're option 1 or an option 2. Perhaps if your child has a case manager, your case manager could help your child with some of those social cues and those social skills. So I just didn't want us, to get moved past and not address that.
That
I
was
didn't want us
good.
to address that. So
Thank you so much, because I do get that a lot from families now that have kids that have autism, and the change and the scheduling and things have been a bit of an issue.
Yes.
I was going to say, if we're being completely honest with ourselves, it's a bit of an issue for all of us on a day-to-day basis. So imagine
with them
experiencing that through a different lens. I can see that without any difficulty.
Well, thank you. As always, we want to make sure our families have the necessary resources to get assistance as needed. If anyone you know that may be struggling during COVID, we have Virginia Cope's Warm Line. It's 877-349-6428. Virginia Cope's offers free crisis counseling 7 days a week. And if you think you know of anyone who may be showing signs of contemplating suicide, please contact the National Suicide Prevention Lifeline at 1-800-273-TALK. That's 1-800-273-8255. Now, for children who may be in crisis, the Chesapeake Integrated Behavioral Health Care has a mobile hotline. It's 757-819-6132. They offer same-day counseling services. But if you want it same day, you have to call between 8 and 8:30, or at least before 1:30 that day if you want to be for the same day. And so again, just, if you want the same day service, just try to get your calls in before 1:30. And then looking for resources to support for a person may be suffering from a mental illness, contact NAMI. That's the National Alliance on Mental Illness of Coastal Virginia, and they're available for assistance. They can be reached at 1-800-950-6264. This number will be placed in the chat box, hopefully. Okay, and then finally, last but definitely not the least, we have Kempsville Center of Behavioral Health, who is your community partner specializing in behavioral health care for children and adolescents. They provide inpatient hospitalization for children and adolescents ages 4 to 18 who are in mental health crisis. They also have a partial hospitalization program, which is outpatient Monday through Friday for adolescents ages 8 to 18, as well as a long-term residential programming for adolescents 11 to 17. Kempsville Behavioral Health offers no-cost mental health risk assessments available 24 hours a day, 7 days a week. Their clinician assessment team can work with you to determine the best next step for your child or adolescent. Just please call them at 757-461 4565 for information on how to schedule your appointment. If you didn't get any of those numbers or the contacts, just go to the Family and Community Engagement website and you can email either Lisa or I, and we can send you that information. And we do want to remind you that this webinar will be placed on the Chesapeake Public Schools YouTube channel within the next week. In closing, I do want to thank Tawana Fortune, Office Chairman of School Psychologists from Chesapeake Public Schools, Office of Exceptional Learning, and Marie Renner, Director of Community Relations from Kempsville Behavioral Health Center. Thank you so much for being with us tonight. It was a rewarding and a very enlightening conversation. In closing, we do want to tell you, if you think your child or someone you know is experiencing severe symptoms of anxiety and depression, and you feel that they are in need of immediate assistance, please contact the Suicide Prevention Hotline at 1-800-273-8255 or 911. Thank you and good night.